Hello everyone, welcome to another series in the Academy of Online Radiology Education. My name is Ricky Olmstead. I'm a radiology resident at the Baylor College of Medicine in Houston, Texas. This month we've curated some interesting literature in abdominal radiology. This first article is published in AJR by a group from UCSD and discusses a complication of barium studies, intraperitoneal leakage, which can occur during fluoroscopic procedures such as upper GIs and barium enemas. The authors followed 18 patients over a 30-year period to demonstrate the evolution of an intraperitoneal barium leak with an in-depth presentation of 4 patients. Of the sequelae, peritoneal adhesion and fibrotic granulomas were the most common peritoneal complications. The patients were not known to have a hollow viscous perforation before the procedure and underwent urgent laparotomy for repair of the perforation. Postoperative follow-up imaging demonstrated retained barium even in the long-term setting. This next article from the Journal of Abdominal Radiology is published by a group in South Korea. They performed a retrospective analysis to differentiate complicated from uncomplicated appendicitis, which have different management strategies. Complicated appendicitis typically requires surgical management, while uncomplicated appendicitis may be managed with antibiotics in certain patients. The authors looked at 1,153 patients with CT findings of appendicitis. They found that appendiceal wall defects, abscesses, diameter greater than 1 centimeter, periappendiceal fat stranding, and free air were associated with complicated appendicitis. They found that any of these criteria were met. This had a 95% sensitivity for complicated appendicitis. This next abdominal radiology article comes from a group at the University of Maryland and discusses mesenteric laceration after blunt trauma. Mesenteric laceration can be a difficult injury to detect, with a reported 60% miss rate. The authors analyzed 147 cases of blunt trauma, 33 of whom had confirmed mesenteric laceration on surgery. They found CT findings that correlated with mesenteric laceration, which included abdominal wall injury, mesenteric contusion, free fluid, segmental hypoenhancement, or adjacent bowel wall hyperenhancement. The authors discuss a list of findings that may be seen with trauma but are not associated with mesenteric laceration, and conclude with a discussion acknowledging the difficulty in diagnosing mesenteric laceration in the setting of blunt trauma. Next, we have an article from Abdominal Radiology put together by a multi-institutional group of authors. This article looks at fluoroscopic derecography, a real-time imaging technique that can evaluate pelvic floor abnormalities. In the article, the authors discuss the indications, technique, results, and common pathologies seen with fluoroscopic derecography. In the discussion of the article, the authors state that while the prevalence of fluoroscopic derecography is decreasing and that of MRI derecography is increasing, the authors still prefer fluoroscopic derecography. Next, an interesting article from the University of Wisconsin analyzing days and times of the week that miss rates were the highest on CTs of the abdomen and pelvis. The authors found that major errors happened on Mondays more than any other day of the work week, and as far as timing, from 9 a.m. to 12 p.m. during the workday. The most common major errors were seen in studies with an indication of neoplasm follow-up. I think it's important to note the authors did not include nights and weekends in their data, and I'm curious how this would have changed things. Gallbladder carcinoma is the most common malignancy of the biliary system. This article from the Journal of Abdominal Radiology was published by a group from India and highlights imaging of gallbladder cancer, which, the article states, is curable only by surgical resection. Many patients are not eligible for surgery based on disease progression at time of presentation. The authors discuss the spread of gallbladder cancer, which is commonly seen in the liver, biliary system, stomach, and duodenum. Imaging of gallbladder cancer is often multimodal, utilizing ultrasound, MRI, CT, and PET. This next article comes from Brigham and Women's Hospital and talks about improving the complex rectal MRI template, which the authors discuss has tried to be standardized over the past few years with varying results. They state at their institution nearly 30% of reports remained unsatisfactory even after the introduction of the template. After they educated the abdominal and oncologic radiology faculty, the adequacy of reports improved. The authors gave lectures and provided online modules which helped improve the quality of reports. The authors discussed the importance of using a standardized template, which can lead to better patient outcomes as all clinicians come to know what to expect from the radiologist's report of the initial workup of rectal cancer. Next, an article led by an author from Yale, which discusses the different lesions that may arise from the retroperitoneum. The article discusses features of retroperitoneal tumors that could be malignant, features that are not suspicious, and then discusses different types of benign and malignant lesions of the retroperitoneum. The article discusses management of malignant retroperitoneal lesions, the mainstay treatment of which includes surgical resection in patients who meet eligibility. Lastly, an article from the University of Michigan, which discusses abdominal imaging findings in COVID-19 positive patients, a topical article given everything going on in the world today. The authors introduced the common findings seen in COVID, which is mainly considered a respiratory illness. They performed retrospective analysis of a little over 1,000 COVID-positive patients and found only about 40 had an abdominal CT at the time of initial workup. The authors found 63% of these had no acute abdominal findings, but classic signs of COVID infection were seen in the lung bases of 76% of patients. In conclusion, the authors stated they could not find any one abdominal finding that should be used to suggest the possibility of COVID infection.
For more details, you can read our blog where you can find links to the original publications. Please feel free to share your thoughts and questions on our forum, and I will see you next month.